It's Health Tidbits with Dr. Kohli. And of course, you've seen her on 9 News. And she has her own practice, which is accepting new patients, Cherry Creek Heart. And today we're going to talk about dry January. It's a huge thing, and I know a lot of people do it. So what are some of the physical health benefits of doing a dry January?
I love Dry January, Jenny, and it started in 2013 with this public health initiative to really help people understand how their body responds to alcohol. So it's a month off of alcohol, and actually now we've adapted it so you can be off of any bad habit that you want. But it's tremendous, the physical benefits that emerge. So almost immediately you start to see improved sleep, more energy, less fatigue, improvement in your sexual function, fewer palpitations, less heartburn. And then if you go the entire month, you can actually start to see benefits like less cancer growth factors in your bloodstream, more insulin sensitivity, and people even end up losing about 4.5 pounds of weight when they go dry in January.
See, that's a good thing.
Yeah.
What are some of the psychological benefits too? Because I know that's what a lot of people are doing dry January for.
You know, it's funny because we look at alcohol sometimes as a crutch. We look at it as a way to cope, as a way to make us feel better. But when you go dry, you'll actually see that it has the opposite benefit. It makes us more anxious, more depressed.
Yep.
And so what we see when people do dry January is that they have less kind of anxiety symptoms, more stabilized mood, less ups and downs, less depression, just overall feeling a little clearer and a little bit more sort of even keeled. So that's a really nice thing. And I think part of that is related to sleep, because even though alcohol sometimes makes us sleep more, it doesn't give us a better quality of sleep. It actually distorts our sleep architecture. So we wake up, even if we've slept more hours, we wake up feeling actually less rested and more fatigued.
That's good to know.
Yeah, yeah.
And basically, how does the alcohol consumption affect the body? When, especially with the holidays, I know that's a huge time for people to drink. How does it tend to affect not just sleep?
I mean, it can have so many different effects. In fact, I always joke with my patients that I know what they've been up to the night before when they come to the office, because their blood pressure is higher.
Yeah.
Their heart rate is higher. So it actually creates this kind of fight or flight response in your body the next day. And it's
You're
because
you can't lie to me. I know how many you had.
That's right. I can tell if they've had pizza, because that also raises their blood pressure as well. So it essentially creates a little bit of a withdrawal the next day when you stop drinking the alcohol. Your body has a faster heart rate. It's a stimulant. It activates your sympathetic
Is that with
nervous system.
even just if it's 1 glass or 2 glasses of wine or 1 glass or 2
It
glasses?
depends a little bit on what your kind of baseline tolerance is. So if you're somebody who doesn't drink at all, even half a glass can do it. But if you're somebody who's used to drinking a glass a day, you probably won't have that with your usual amount of dose. But there's so many different factors that go into it, because if you're dehydrated, if you're sleep deprived, if you're already anxious when you're drinking, or you don't have a lot of food in your stomach, all of that can affect the way that the alcohol is absorbed. So it has kind of short-term effects like that. In the long term, like I said, it can make you gain weight because of all those calories. It can make you insulin resistant. And, you can even get cancer from alcohol. It's one of the leading preventable causes of cancer. So it's not good for our body.
No.
And it's not popular to say, but the Americans are now finally trying to revise their guidelines. We used to say 1 drink a day for women and 2 drinks a day for men is considered okay. Now we're saying 1 or 2 drinks a week. For both men and women.
And do you
Ideally,
think
0.
that dry January and this whole initiative, how can it long-term affect your consumption of alcohol?
It's amazing, because this is almost like resetting your behavior and your brain. And that's what I love about dry January. It doesn't just have to be dry for alcohol. Like I said, it can be any bad habits. For me, it's online shopping. I'm going to try to take a break and see if I can change my behavior. Because what we see is that if people actually stop drinking in January, 6 months later, they're likely to have less alcohol, drink fewer days of the week, and have fewer drinks when they actually drink. So even if you start drinking again in February, it actually sustains for quite a long time, which is a really nice thing. So to me, it's a chance to really think about whether it's social media, screen time, any other behaviors, how you can reset. And for some people, they feel very daunted by the idea of a whole month. So you can start to see benefits in as little as a week.
Yeah.
And I say for our teenagers, we're never going to get them to go 1 week off of screen time, right? Even though they just did a study that says if you go a week off of social media, it can reduce your risk of anxiety, depression, and help your sleep by 15 to 25%.
Wow.
But that's never going to happen for a teenager. So instead you say, okay, I'm going to go dry social media January by cutting down my screen time by half an hour. every day.
Yeah.
And that's a very doable, achievable goal. And what it does is it doesn't just obviously have the benefits we talked about, but it changes the way that you feel in control of your behaviors. So that you
More
can
aware
say,
of it,
yes.
more, yes.
And you can say, I'm in control. The behavior is not controlling me. I don't have to chase
So if you're
that swing.
somebody who might or might not have, had 2 glasses of wine last night, with dinner,
hypothetically.
hypothetically, as like this is, that doesn't necessarily mean that dry January is shot. It just means that you just kind of be more aware of it and then
Yes, and
start
so
again.
maybe the next night you're thinking about drinking, you say, hey, I'm going to cut myself off at 1. Or maybe I'll have a sangria, so there's a little less alcohol in it. So it's just being mindful of your behaviors to really try to understand how you can change the things about yourself, especially in midlife, that are starting to hurt your health.
Yeah, dry January. It's happening. It's happening right now.
How about dry-ish January?
Dry-ish January. I like that.
that?
We should.
Okay.
We're gonna
We'll just do
copyright
that.
that. Dr. Kohli, make sure you check her out. 9 News and at Cherry Creek Heart.